South Africa to help fight the spread of COVID-19 has drawn mixed reactions from a number of groups. While some have welcomed the assistance to be offered by the health professionals, others have raised concerns on the national placement of the local doctors, citing the neglect of junior graduates. Now, to help us understand these issues better, via Skype is health activist Dr. Kgosi Letlape. Doctor, thank you very much indeed for coming on.
Thank you for inviting me, and good morning to the viewers.
Always a pleasure to have your perspective on issues on health. Talk to us firstly with regards to the arrival of the Cuban health professionals and some criticism that followed. What's your take?
My take is that given the fact that we are a nation with insufficient healthcare professionals, in particular doctors, any form of assistance should be most welcome, particularly in relation to the fact that there's an ongoing pandemic and we're in the middle of a lockdown in relation to COVID-19. So any assistance is most welcome.
Is there an argument to be made, on one hand, bringing outside help to assist in the fight against COVID-19, and then dealing with some of the domestic issues, local issues, with regards to unemployed health professionals?
I think it would be akin to having a house on fire. And when you have your neighbors coming to help you, you're telling them that you got unemployed children. It's time to put the fire out. And it does not mean that there are no lessons to be learned for long-term use. And what we should be doing is to be welcoming them, but ensuring that their assistance is not lost, that they come in to help us transform our system. If you compare the system they come from and the system that we have, they come from a national health system. I've been listening, and you've been talking about issues of lack of PPE and the challenges of provincialization and national competence. And we have seen on television the challenges in a well-endowed system like the US in terms of resources, where there's challenges between federal and state. And the state are appealing to federal to coordinate. And I hope one of the things that will come out of this is to emphasize to South Africans that we need one health system, and health needs to be a national competence for it to be done effective.
You know, you talk about some of the lessons that can be learned now for long-term use. What about the lessons that we are learning from this pandemic and how it will talk to NHI, for instance, and how we move forward with regards to that? What would you say are some of those lessons that we can learn?
I think one of the problems that we have as South Africans is that we're good on manifestos and producing papers and meetings. We've been talking about a primary healthcare focus for ages, but there's no movement in that regard. And the reason there's no movement in that regard is that we are genuinely dishonest. In that those of us that sit in these meetings and talk about these issues live in a different health system.
How so?
Where we don't
How
really
are we
care
being? Where's the dishonesty? Talk to us about your take on that.
The dishonest is that we are all on medical aid. We go to a different system. We talk about sectors in this country. We don't talk about nationhood. And that is the challenge. We'll always talk about this sector, that sector. And I think one of the lessons that I hope will come out of COVID is that the ministry will be a national ministry. That's a ministry for all South Africans, and that all sectors need to provide services to all South Africans, with the ministry on top being custodians of a national health system. We talk about a primary healthcare focus. I think one of the things that they can teach us is what that truly means. Our system, we wait for people to get sick. And when you're sick, you got to go and look for a healthcare professional. In their system, the healthcare professionals are in the community. The doctors go to the community rather than waiting for the patients to come to them. The doctors are also focused not just on illness, but on health. That is why their system is extremely efficient on contact tracing. It's extremely efficient on prevention. And when you have a thing like COVID, they have a more robust system that is well prepared for dealing with pandemics.
Tracing, testing, key in the fight against COVID-19. You spoke about, people in Cuba, the health professionals that are going to the community in order to assist. So you see similar scenes here in South Africa in terms of testing. We are no longer, this is what we're told by the health department, we're no longer waiting for patients to come to hospitals, health facilities to get tested. The screening is now taking place, going to the communities. We have these mobile vans that are being deployed. You say this is a good step in the right direction, and these are the lessons that can be learned going forward.
Yes, it is. But when you look at the Cuban system, it's embedded in the system. It's not an outbreak response.
Right.
It's how the system. I was fortunate to be in Cuba in March. And before they even had any cases, they were preparing for COVID. And when they had a few imported cases, they'd already started wearing cloth masks in terms of the health officials. They had embarked on a program where they were deploying their doctors and their medical students that are in clinical years to go out into the community to go and do the epidemiological survey of interviewing families and asking about travel, asking about any respiratory illness, and starting to do the contact tracing. But the system has that ability and it's prepared for that. We had to go on a crash course to recruit community health workers, to train community health workers. These structures should be embedded in our system. We have to reorientate our healthcare professionals to be embedded in society and to be focused on promotion of health rather than having an expensive sick system.
So,
the curative system is important.
Doctor,
prevention is better than cure.
100%. Look, you're talking about the levels at which Cuba is at in terms of health services, healthcare professionals providing the services to the community. Somebody sitting at home saying, how do we get there, doctor, here in South Africa? And what sort of timeframes would you say that needs to be put in place in order to get to that level of healthcare?
I hope from what the president has been saying, he gets the sense that this is a matter of urgency. There's been this issue about NHI and 2025. We can't afford to wait for 2025. Why are we procrastinating improving access to care for many citizens in our country? It is selfishness. It is prolongation of apartheid in health under a different guise. So the issue of creating a health system for all of us now has to be treated with the urgency with which we dealt with COVID-19. There can be no procrastination. And there has to be preparedness that all the resources that we have should be available to all citizens of the nation. You've been speaking to others about the issue of unemployed healthcare professionals.
Yes.
This is a problem of the two-tier system. When you look at what we have in private, the ratio of patient to doctor approaches the ratios on OECD countries. When you look on what we call the public sector, which basically is a euphemism for apartheid health, the ratios are quite horrific. We as privileged South Africans have to stand up and stop committing a heinous crime against the people of this country. We need to build a health system for all of us, and that is a matter of urgency, not procrastination.
When you look at some of the messaging coming through the various press briefings that we've been having almost on a daily basis, not only dealing with regulations, but the health minister has been at the forefront leading this charge in terms of keeping the nation up to date with what is happening in this country. But when you hear a report from the HSRC, the Health Science Research Council, saying that 1 in 2 South Africans believe that they are at low risk of contracting or getting COVID-19, what does that tell you about the messaging that is getting out there to our people?
What it is telling me is that we have a poor ability to communicate to all citizens. And we are a divided nation. And that's what it brings up.
But what more can be done, Doctor?
Take things for granted.
When we're having daily news briefings, what more can be done?
Well, I think what needs to be done is how many of our citizens have access to those news briefings.
Correct.
Me and you. How many South Africans are listening to us? Are we on radio? Are we using the means that will reach the majority of our citizens? It was heartbreaking to see when we had the people enforcing the lockdown. In some of the areas, people seemed like they were hearing of a lockdown for the first time when it was being enforced. So I think our ability to communicate to all citizens equitably at the same time, in a manner that people understand, is something that we need to improve on. When we've created a dispensation of 11 official languages, we need 11 times the effort to ensure that we communicate to everyone.
So you're talking more boots on the ground, so to speak. And when I talk about boots here, I'm talking about healthcare professionals, social workers, those kind of people on the ground going to communities, both urban, rural areas, and educating our people with regards to COVID-19.
I'm talking even more radical. Take the 400 MPs that we have. They speak the 11 different languages. Deploy them to community radio stations to talk about the lockdown, talk about COVID, engage the communities, go to local radio stations. You can't have town meetings because of the issue of the problem of spreading the virus. But we are not using the means that are available to the majority of the people. We sometimes take things for granted that everybody has access to a television.
Yeah.
And that is a mistake. So we should be using radio more. We should be deploying officials. All these ministers should be sitting in radio stations talking to people locally and explaining to people so that the reach is quite extensive. There's also an inability of people turning information into knowledge.
Right.
And you have this divide where we fail to bridge the class divide. When COVID started, we failed in making people understand that even though it is going to be brought in by travelers, it's going to affect all of us. So there was this notion that if you do not travel, you are not at risk of contracting the virus. We did not do that well in terms of explaining to people what community spread means.
Yeah.
And we now need to learn from what has been done that our current communication protocols are not reaching the majority of the people. Our way of speaking does not enable understanding for the majority of the people. So there's an art in terms of how you communicate these things from scientific speak to common language speak.
Because we need to break it down.
Better understood
Yeah.
and the uptake is good in terms of our understanding and our being able to use the knowledge to protect not only ourselves, our families, our neighbors, and our communities.
And that's what we're trying to do here, Doctor, especially at SABC News. You're trying to bring in the experts and trying to break it down and speak to our people in the language that they understand, because, I mean, some of these terms fly over my head in terms of these medical terms. If you don't understand it, you won't follow regulations because you don't believe in those regulations in order to protect you. Very important. Prevention is key. Then you don't have to deal with this unknown. There's so much unknowns with regards to COVID-19. Sir, we need minds like yours. We need your perspective as always. We will touch base with you soon to get your perspective on issues. Thank you very much indeed for your time. Be well.
Thank you for inviting me. And I hope we will understand that we need to engage people by making them understand how what we are dealing with will impact them. Unfortunately, in South Africa, we have a culture of selfishness. It's me, myself, and I. And the way to reach people is to be able to make them understand how what you're trying to bring to them, how they are impacted by that, and how they have a personal stake in ensuring that we deal with COVID-19 and stop the virus in its tracks.
Yeah, we're in it together. As I always say, this is a disrespectful virus. It knows no boundaries, no cultures, no creeds, no race. It affects everybody. Everybody's at risk to contract COVID-19. So thank you very much indeed, sir, for your time. Be well. We'll chat to you soon. All right.
Thank you.
That was Dr. Kgosi Letlape, a health activist, talking about the importance of working together as a nation in order to get over this hurdle of COVID-19, fighting together as a nation. And we need to, for now, stand together by staying apart. I'm talking about social distancing, physical distancing in that regard. Well, the Cuban medical